I'm Dr. Rosalyn George from Wilmington Dermatology Center in Wilmington, North Carolina, and I'd like to give you some tips on how to deal with some common skin problems. One of the most common complaints I get in the office is bumpy skin on the backs of the arms, and sometimes people can get it on their legs as well. It's a condition called Keratosis Pilaris, and it's basically little clogged hair follicles. It actually affects about 50% of the population, and it frequently starts early in childhood, but it doesn't become a problem until puberty. And it can be very cosmetically distressing to patients who have this condition. Unfortunately, there's no cure for it, so we're just trying to manage it. And the best treatment for something like that are light exfoliants, things with glycolic acid in them, ammonium lactate, urea. Those are some ingredients that you can use to lightly peel off layers of the skin so that you can get rid of that bumpy skin. In addition to that, you need to apply a heavy moisturizing cream. Cetaphil and CeraVe creams are specifically designed for that. And they help replenish the moisture in the skin. Another common skin problem that is very prevalent is a condition called melasma, and that is what people get after sun exposure and hormonal changes like birth control and pregnancy. And it appears as brown splotches on the face, and it can also be very distressing to patients. There are a lot of treatment options for the melasma, but you need to consult a dermatologist to have many of them performed or to get a prescription product. The main thing for melasma is prevention, so good sunscreen. People get a lot of incidental sun exposure. I call it the sun that they don't count. Going to the car, going into the store, dropping the kids off at school, and they don't think to put on a sunscreen. And sunscreen needs to be like brushing your teeth. You got to put it on every single day. So good prevention is the first thing. The second thing that you can do is there are topical lightening creams. There are chemical ones, most commonly used hydroquinone, and then there are other ones that are a combination of retinoids, steroids, and an alternative bleaching cream called Mequinol. That goes by the brand name of Triluma. And those are very effective at lightening the skin. People who do not want to use chemicals, there are plant extracts that can lighten, and the most common one that is on the market now are things with kojic acid in them, which can also lighten the skin. And there are some over-the-counter lightening products that will have some benefit, but the prescription ones seem to be a little bit stronger. Other things that you can do is a chemical peel to peel off the brown spots on the skin, and then as a last resort there are laser resurfacing procedures that you can use to resurface the skin and get rid of the sun-damaged skin. That's some basic information, but before you start any skincare regimen or have any procedures, make sure to consult with your skincare specialist or dermatologist.